I'd like to, I'll wait on David, he's coming in. I'd like to call the meeting to order of the Board of Leavenworth County Commissioners. I'd like to invite everyone to stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Begin with a moment of silence. We'll start with a roll call with Chad Shimke. Here. Doug Smith is present. Jeff Culberson. Here. Vicki Cause by phone. Here. And Mike Stevens by phone. Here. All commissioners are present in some form. So we'll open up our meeting. We'll just start with Mr. Miller.
Morning, commissioners.
Morning. Morning.
Here to basically present some of the updates to the COVID-19 within the county, as well as answer any questions that you may have, just kind of have that dialogue. The first I'm going to open up is just on the overall progress that Leavenworth Health Department and the Health Officer's Office has had. We have opened up an IMT, which is Incident Management Team. I have brought in individuals from actually outside of just the county itself to fill some of these positions within the IMT that have some experience and such with fulfilling the obligations when you open such a task. So with that, Todd Farley is here with me today. He is actually sitting in the command staff of the IMT. He is filling the planning portion and also kind of overseeing the Joint Information Center of the IMT. Also in the IMT team, Chuck McGaha is filling the EOC role. I have a logistics chief, which is Kim Buchanan. She is actually out on staff with us for all logistics within the county, or filtering through her. Operations, I have branch directors of EMS, law enforcement, and fire that are all being stood up within the IMT team. So again, this is not just a singular event where one person. We have an entire team that's established, and we're working off an incident action plan that is wrote for operational periods throughout this to evaluate what the needs are. We also brought in some outside PIOs to assist with getting the information out in social media, our websites, to news crews, all of those type of. So anytime a press release is out there, that is going to all of the key media outlets and such that needs to get that information out. Just as our last order, that was to the news group. That went out the night of Saturday, 21st, and when I was in my office on the 22nd, we were part of the reporting from the news channels and such of having that information out there. So there was some confusion, I know, in the community that the information was not being pushed out. It was being pushed out as rapidly as we can out of our incident management team. So with that, real quick, just from the health department standpoint on testing, I know that's something that's kind of being popular. Just real quick on the numbers, total testing, we report this every day. We try to get it out by 4 o'clock, all of our numbers kind of up to date and what has happened. As of this morning, I pulled the numbers. We're at 88. We tested 45. 34 were negative. We had 5 positive, and we still have 6 pending results. From private labs, we received 43. 33 were negative, and as of this morning, we received that we have an additional 2 positives that we'll be releasing out this morning. So I don't know all of the specifics on those. That just came as I was going out the door to this meeting. So we will be announcing those in a press release here very soon. Again, there's 2 additional cases that have come from private labs. We're also aware of 8 additional pending from private labs that we're waiting on those results. So KDHE throughout has changed guidance on testing almost on a 24 to 48 hour kind of window on what the criteria is for testing because of testing supplies and such. We did put out the statement from KDHE yesterday on our websites and everything else, and I just want to kind of reiterate that. Effective yesterday, due to the wide-scale shortage of laboratory supplies and reagents, testing at the Kansas Health and Environment Laboratories must be prioritized for public health purposes and urgent need. KDHE will be prioritizing specimens of COVID-19 testing, which will be reserved for the following patients that meet Kansas patient under investigation criteria starting March 23rd. Those criteria are health workers and first responders who have COVID-19 symptoms, potential clusters of unknown respiratory illness, priority given to long-term care facilities and healthcare facilities, hospitalized patients with no alternative diagnosis, individuals over the age of 60 with symptoms of COVID-19 with priority given to people who reside in a nursing home, long-term facility, or other congregate setting, or individuals with underlying conditions that would be treated differently if they were infected with COVID-19. That is our testing criteria at the health department that we have to, because again, our laboratory is KDHE's lab. On their form, if they do not meet these guidelines, we cannot test. We cannot test and send that into KDHE and have them perform the test. Now, with that said, we are moving towards community spread. Predominant number of the cases that we are seeing in Leavenworth County are not from travel anymore. It's from some sort of contagion here in the Kansas City metro, local, so on and so forth. What that means is if you have the signs and symptoms, you have fever, you have shortness of breath, you have the cough, you have any of the signs and symptoms that have been identified as relating to COVID-19, you are being presumptively positive with COVID-19. It's the same way that Johnson County has moved. We're not to that point yet, but I am assuming with these positives that we received today, if they are, that KDHE is probably going to look at Leavenworth County as also moving into community spread, and we would be another one of those community spread style counties. I can't say that that's where we are yet, but I am pretty Johnson County moved to that when they had 5 that were community spread, and they could no longer track where those individuals actually contracted the COVID-19 from. I can tell you we are experiencing phone calls at our call center of many people that have some signs and symptoms of fever, cough, things of that nature, but they don't hit any of the criteria to be tested. So we know that even though we have the positive now 7, there are probably a lot more within our community that actually have this disease. So our call center is basically giving the information as it is stated even from KDHE, inform all patients who present with signs and symptoms to remain in place and to isolate if they have a fever over 100 or greater, lower respiratory symptoms including cough or shortness of breath, and who are not in the high priority for testing. Self-isolate at home or another appropriate location for 7 days after the onset of illness or 72 hours after resolution of fever without fever-reducing medications and significant improvement in your symptoms, whichever is longer. I can tell you that we are monitoring one of our positive cases is coming up on the end of that, and we believe we will have our first recovery to report here very soon in regards to our COVID-19, which is a positive. As we're hearing all the negative, it's also sometimes nice to hear the positive out of and have a recovery out of one of our cases that we'll be able to clear out of the positives. So that is also what drove the decision making as we were taking in phone calls and some of the shift in the guidance, knowing that was coming down. I was on conference calls with all the health department directors in the Kansas City Metro, as well as some of the health officers on the phone on Saturday before the emergency orders were to come into effect. And this was something that was discussed amongst all to try to go to the next mitigation of how do we, again, force social distancing to flatten the curve. I know we've heard this term over and over and over. But again, as I spoke on the last time I was in front of the board, that is our process in public health, is to try to sustain our health system. Our health system within Kansas City is Leavenworth County's health system. I've had some discussions with key leaders. We don't have the ICU beds. We don't have the ventilators here in Leavenworth County. If we get into Kansas City and us being affected, those hospitals down in Kansas City are going to be our ICU rooms. They are going to be our ventilators. That is our healthcare system. So again, we are looking at this as a regional look and not just an island look. We're not looking at this necessarily from just a Kansas outlook. We really have to look at it from the Kansas City metro look because, again, Missouri's numbers are way out ahead of ours, and we don't want to be behind in making some of these decisions and really trying to flatten that curve to make sure that when healthcare is needed for any of our community, we have that available to us, and we're not fighting for ICU rooms or ventilators that aren't going to be available. So,
Jamie, if you give me a minute, I just want to follow up a little bit on what you just said there. I know we've received some emails and phone calls from people questioning the timing of issuing this order. And that they think that maybe we're ahead of the game a little too far. But I just wanted to run some numbers by that are real numbers that anybody can verify if they'd like. 21 days ago, the state of New York had 0 cases. 14 days ago, they had 173 cases. Today, they have 20,885 cases and 158 deaths. So in 2 weeks, they went from basically where we are to 21,000 cases. They issued their stay-at-home order 2 days ago. I think they were a little behind the curve. New Jersey, 21 days ago, 0 cases. 14 days ago, 1 to 10 cases. 10 days ago, they are where we are right now. Today, 2,844 cases with 27 deaths. They also issued their stay-at-home order 2 days ago. I understand they are much more densely populated with different kinds of transit, but those are just an example of how these numbers can blow up overnight. They should have taken the orders, stay-at-home orders, 2 weeks ago, which is where we are today, and why I think it's important that everybody understands why the metro area is taking the actions they are, and why Jamie is taking the actions that he is. That's all I had, Jamie.
Any questions of Mr. Miller?
I mean, first and foremost, I want to thank you, your staff, the task force. Long days, very long weeks. Not lost on any of us. I got a handful of things I wanted to get feedback on as we discussed this morning. But first and foremost, it was to remind everybody that this is a team. The Board of County Commissioners has been fully supportive of you, your staff, everybody involved. We're staying informed. You're keeping us informed. It seems to be that whoever makes an announcement is always the lightning rod for scrutiny. And this is very much a damned if you do, damned if you don't. If you act too soon, you're going to get criticism. You act too late, you're going to get criticism. You do nothing, you're going to get criticism. So realize that most of us in these roles realize that it comes with the territory. It's unfortunate. But want to thank you for the way that you've handled it, and sorry that it hasn't been more clear, but it's been with our full support and understanding. So again, thank you. I wanted to make that statement first. You already hit on the healthcare solutions or lack thereof. That's been one of my bigger concerns, and we've talked about it since many of our installations have pulled out. I don't know that people really understand that if emergency hits our community, we are vastly under-resourced. So that means those adjacent counties are our primary healthcare options and services. So following suit does make a lot of sense. And while there's a lot of people saying, well, why are you mirroring a Johnson County or Core 4? And at the same time, we obviously can't compare ourselves to New York or New Jersey because of some of the very same arguments that are made. I think people need to realize that our top employers, we don't even have a private sector employer that employs over 500 people. If you go to Johnson County or Wyandotte County, their top 10 all employ over 1,000 people. Again, I'm talking about private sector versus public. I don't know where people think our 30,000 cars a day go, but they go to work somewhere. Now, I realize as much as anybody that technology has advanced us a great advantage in this stay-at-home environment that we're in, but it doesn't work across the board. So obviously there are a tremendous number of businesses that are impacted, layoffs that are impacted. I think those are the things that we need to be talking about and trying to find solutions for, and good communication both to our residents that are out of work, our companies that don't know what to do for the next 30 days. Those are some of the other challenges that we're going to be faced with beyond just the safety of our residents. So those are some of the things that from time to time I might bring up just to have questions about, not in criticism, only to make sure that we only have so many tools available to us at the county, right? The state's already come out, they've moved deadlines, they've waived late fees, they've been creative to try to minimize the overhead burden on any particular family, and it won't be enough. I'm thinking of things that we're doing here. We've already now, through the approval of the state, we can dealing with tags, dealing with late fees. I know that personal property tax payments are going to be due here next month, actually in May. So that's something that we want to talk to our representatives about and make sure that the state's looking at that. That impacts. I mean, that's one thing the county can do to hopefully take some of that pressure away from people with this burden. So. Again, I can't thank you enough. We can't thank you enough. I think our demographic being under-resourced when it comes to healthcare solutions, one of the things that we recently talked about was we're commonly recognized for having a very large retirement community and population because of Fort Leavenworth. Actually, across all of the bases, please correct me if I'm wrong, we have the #1 retirement community from a Department of Defense installation. So we have a very high at-risk, age group in general. Look how strong our Council of Aging is, as an example. So those are things I think we need to be cautious of, especially when we don't have the resources if it were to spread like we expect it would. When you talk about positive test results, well, I'm not a mathematician by any means. But if we're going to experience across any metro or historicals from other states, if it's a 5% positive rate or a 10% positive rate, it's probably not outside of the realm of possibility that anybody that's calling in that has very similar symptoms, that while we can't test them because we don't have the test kits, we don't have the volume that we need, it would probably be a fairly similar result. So the cases probably look very different than what was yesterday 5 and today 7. Not to mention how many people that still fall into those essential, critical infrastructure type jobs that are going to Johnson County or Wyandotte County daily. So while some of our residents here don't make those commute, I assure you that many do. So. And the only other thing I was going to say is I don't pay a lot of attention to Washington usually just because it frustrates me to no end. But I know they are getting very close to, I think, what they had planned to do when some of these restrictions were coming down, is to have a plan and funding and things available to a lot of these businesses. So when I said 500 kind of being the cap of one of these next stimulus packages, every private employer we have in Leavenworth County qualifies under 500. Again, we don't even have one. And those are dollars that are going to be available to them. And I think that would have been, had they been able to roll those out side by side, it may have looked very different for employers. And it's unfortunate that Washington is so broken that did not happen. So,
a lot of them's on quarantine.
Yeah.
Commissioner Stevens, do you have anything for Mr. Miller?
I just have one thing, and Ken, I heard most of that, but if you guys speak into the microphone, I can hear just a tad bit better. But my question was, could you address, if someone does have the symptoms, what they should do, where they should go, who they should call? Could you specifically address that?
Sure. If the first and foremost, if someone is having mild to moderate symptoms, they should be reaching out by telephone, either to their private health care provider and or to the health department. From there, they will be given guidance whether they should go to an emergency room, some evaluation triage, or if they should be seen by their private care facility provider at their facility. And the big reason for that is to allow for those providers to also be protected. if someone just shows up and they're not protected, then everyone that is potentially exposed to that individual becomes exposed as well, and the chance of contagion being spread is much more. So again, if someone is at home and they're providing or experiencing mild to moderate symptoms, they need to reach out by telephone call. If they believe that they are having any sort of medical emergency that is severe, the severe respiratory distress, short of breath, things of that nature, they can still call 911. 911 is going to, they're going to be asking a few more questions, obviously, and that goes down the infectious disease. But all of our EMS and first responders and everything else, part of this whole plan, everyone is on board with PPE and things of that nature. There's already a plan in place to get them to a hospital to be cared for. So again, mild to moderate, phone calls to your private healthcare provider and or the health department. We will guide you through what the next steps may need to be, or monitoring, reaching out. If it's more on the severe side or life-threatening side, then you will call 911 and the process will take its course from there.
Yeah, that's all I had for today. Down the road, I'll have some questions about, the economic balancing and all those types of things. But I think right now the important thing is addressing the sickness and the issues that are at hand about that. Thank you for all you've done, Jamie, and your team.
Thank you.
Commissioner Cos, do you have any questions of Mr. Miller?
No, I have no questions. I just want to thank Mr. Miller and his team for all the hard work that they have been doing over the past several weeks.
Okay. Thank you. Commissioner Culverson, any questions?
Not really. I just wanted to reiterate, half of the phone calls I get are constituents concerned about safety, and the other half I get are concerned about the economic devastation from this. And they're asking me, what is our goal in this? And, what I've been telling them is our goal is safety first, economic second. And I feel that's the right way to go. So, yeah, this is going to be bad on the economic side. We're going to have to figure that out. But I think our low numbers of outbreaks speaks volumes to the precautions that we're taking already. You can argue with them and say, well, there's not very many breakouts. Why are you going to such extreme? And my rebuttal is that's why there's not so many breakouts, because we're going to these extremes. So that's about all I've got.
All right, well, I'll follow up. Once again, thank you and your staff for all you do. I know you're working around the clock 7 days a week. And like Chad said, the person that announces it gets the lightning bolt. So, but I think we got to practice our social distancing and caring for others. I mean, it's that simple, and it's life we're trying to protect. And like I said, we do not have the full service hospitals here in Leavenworth anymore like we used to. So now, is Council on Aging, are they being able to keep up with the needs of the requests from the elderly population, say deliveries and stuff like that? Or are they going to need some additional help? Or?
So the people who were on services prior to this, they still are able to provide the support to.
Okay.
They've obviously reduced some of the services that they offer, and nothing in the building anymore. There's no in-person services being offered in the building. So mainly what they're doing is anything they can do over the phone, and the Meals on Wheels that they deliver, they still are able to do that. And then the meal sites, what they've done is go to a kind of a drive up, get your meal and drive off type process. So they don't have capacity to add any additional people. Some of the other challenges they're running into is they provide grocery services for those who are homebound. And they're still able to do that because it's people who are on the service. The challenge is that typically they would take those inside for folks, and they're trying to figure out how they address that. How do we don't want them going into these homes and potentially exposing themselves and others. So they're trying to work through that, but they currently have the ability to continue to provide services to those that were already on services. They do not have staff to expand those services at this time.
Okay. And how's your staff holding up? You have enough staff to do what you need at this time?
Again, that's something in the incident command system that we're starting to look at getting some deeper layers of deputies and such that are going to be able to step up into roles. So those of us that have been going for about the last 14 to 20 plus days will get a break and be able to step away for a minute. We're monitoring staff. We're rotating staff out, making sure that no one's becoming fatigued and such. There's certain members, Todd, myself, operations, that have been kind of that core team that has been there nonstop, if you will, that's going to have to eventually back away and allow some others. But the nice part about the IMT team, it sets out what those objectives are and how things are, and we've set that up. So even if we're not there, the operations don't change, things don't change, but as decisions need to be made, things can still be made in the operational plan as it's wrote. So I think we're doing okay right at the moment. I think we have enough staff. We're adding staff. I'm working with Mark. If we need staff, we have staff identified within just the county's staff within itself. So if we need people to come in and backfill into the call room or such, we'll have those identified and be ready to pull that trigger if we need that to happen. As of right now, I think we're identifying and taking care of the needs that we need, but we're looking beyond kind of that site picture. If we do need additional staff, it's already being identified and what that's going to look like.
Jamie, can you, with technology today, you're never not available. You're never truly not working. That's the good and the bad. Can you guys look at or have you going into any type of a rotation? I'm looking at Chief Farley right now and thinking about how it's not uncommon in the firefighting field to be, a 2 on, 1 off, some type of schedule, because again, if you're not your best, you can't do your best, right? So I just didn't know if that's been, I realize it's easier said than done, especially when a lot of times when you don't have a massive team, there's a lot of single points of failure, but curious what that could look like or if you've looked at it yet.
We can't hear Chad.
Okay. Just to repeat the question, I was curious if they could go to any type of a schedule that might allow for key personnel to recharge a little bit, whether that's a 2 on, 1 off, some type of schedule that might allow for those that have been at it for many days, many weeks to get back to their best, so to speak. With technology, you're never truly unplugged. You could always be wherever you need to be, probably within 15 or 20 minutes, worst case scenario. Just wondered if that had been discussed yet or what the plan was.
So in just about every disaster, when you stand up an incident management team, there's always the beginning, the first part of the incident where you're developing incident action plans and you're developing objectives of how you're supposed to do it, and you're trying to find a rhythm on how all of this is supposed to happen. And typically you have key leadership that is for the first 2 or 3 operational periods that are truly working nonstop to find that rhythm. And so we're now, as of this morning at 9 o'clock, into our 3rd operational period. And so we're finding that rhythm. And I would say even during the end of the 2nd operational period, we were really starting to get there. And so with this one, I think we're there. And so as we start to get into that rhythm as key leadership, we start to get that comfort level of our objectives are working. This is exactly what we need to be doing. And so as of this morning, we brought in a fire branch director, an EMS branch director, and a law enforcement branch director. And the instructions during the command briefing that we had this morning was all of us need to find our number 2 person and start bringing them in, not to fill those positions, but start bringing them into the command post to be able to, they can get their situational awareness so that when it is time for us to step away, then we can, and that position, that deputy position, comes in and fills that position. It's not like they're starting from day one. Oh, there's the objectives.
Right.
No, they're a part of that today. They're a part of that. They're getting trained, if you will, and updated on what's going on. And so that we're in that rhythm now, I think, and I'm very comfortable with where we are now that we're into the 3rd operational period.
Good deal.
May I interject a question or a request?
Absolutely.
Okay, first of all, I think it would be a good idea, number 1, to put out the email addressed for individuals that might have questions, just so that it's out there, or, you know, in this meeting for people that are listening. And then number two, that the team is going to kind of triage how they respond and when they respond, because you may not get an immediate response to a question that you might have. And that using the health department phone number calling in should probably be reserved for people who are feeling ill or, you know, have health concerns versus questions about who might be affected or not affected by the order that was imposed.
The email of JIC at leavenworthcounty.gov was put out yesterday in a press release. If people have general questions or want general information, to send their question by email so it can be answered. And again, it's being answered because there's multiple of the same question that may come in, and we can kind of generalize that and put that out also as frequently asked questions on the websites. The phone bank that we did set up is being answered by generalists that are triaging. Is it a general question, or does it need to go over to the medical side on the clinical side? And so we have the ability also within the phone bank that it's not being inundated just by general questions. Those can be immediately put over to nurses and such on the clinical side to help on the side of those that may be feeling ill or need that direction, as well as then also pushed over if it's a question. And those individuals also ask that those individuals may, that are calling in, put in a email so it can be answered in writing and such back to them, because a lot of it is questions that people are going to want or need later on, so that way from the CHIC the answer is placed back to them in writing.
Thank you.
And how are you doing on your personal protective equipment? Do you feel comfortable with what you have?
We are in the process working with, again, we have Kim standing up our logistics and doing all of the queries amongst all the first responders, nursing homes, anyone within the healthcare system, if you will. And that's first responders all the way through long-term care, nursing care, hospitals, so on and so forth. Because again, in our jurisdiction, when we get into declarations like this at the state, and when we're talking about stockpiles and national stockpiles and those being delivered, those deliverables have to go through KDEMS, Kansas Department of Emergency Management. So there's a process to request, get, and whatnot. We're in the process right now of querying all of our numbers of where we're at. We know where we're at already on a locale or a local stock, but we're in the process now of what do those orders look like and what is coming in from the Strategic National Stockpile to our request. I don't have that answer yet, but what we're also doing is looking out still on the private sector on purchase as well, because I'm not going to just look at what's going to come in from the government or what's going to come in from these stockpiles. We have reached out, and we do have a few availabilities to potentially make some purchases to up our N95 masks and things like that to protect our staff. So we just got those numbers again late last night that I'll be working with Mark on what level do we want to make purchases to have some of those reserves as well on top of whatever may come in from strategic national stockpiles, because again, that's going to be wave one, but we also know this is not just our local, this is the strategic national stockpile, which is going to the New Yorks and going to all of these areas. So we're all again fighting for the same mass in PPE. As of right now, to answer your question, we have enough to fulfill our day-to-day functions as we are, but what we're also looking at is burn rates. So how quickly are we going through it? Obviously, as the number goes up of individuals, we have to go on our calls, we have to deal with individuals. That burn rate is going to start increasing, which is going to start depleting our stockpiles. So we're trying to also, as we are with these orders, we're also trying to be ahead of the curve in our stockpiles locally as to what we have available.
Jamie, would it fall to, like, say, Kim in this, as far as the task force goes, like, you know, there's reports all the time of what they're trying to do to be creative, to find solutions to even reuse, repurpose equipment. So UV light is something that I've recently heard, but someone that's researching to find out what maybe could be used to prolong or keep our stock going longer.
So one of the things that we're challenged with is exactly that. So when we start hearing things like that, or if you watch social media, there's a lot of different makeshift masks and things like that. And as first responders, healthcare providers, we have to follow the CDC guidance to protect our employees. I mean, we're kind of mandated to do that. But I think the other thing that we've done in Leavenworth County, and just all the fire departments, EMS, we're looking at what contingencies do we have right now under our own roofs to combat this, right? And so I'm a fire department. I've got 22 sets of self-contained breathing apparatus that we use for structural firefighting and fighting car fires, but those are all positive pressure masks. We have a lot of those. The reality is if we run out of N95s, we may be delivering patient care wearing what we wear into a building fire to protect us, but the other side of it's not just about protecting us, it's about protecting the next patient as well. And so we have a responsibility to make sure that we're going through all the decon procedures when we go out and treat these patients, known or unknown, and that we're ready to go out and treat the next patient without being part of the problem. And so all these discussions are happening. Right now we're anticipating today to get a countywide policy out for all first responders to follow, so that we take action now to protect the amount of equipment, personal protective equipment that we have. You know, the days of us going to a medical call with 4 firefighters and all 4 of us running in and taking care of a patient, even though that's what we really want to keep doing, today it's changed. And so these policies address that. The citizen will still get the level of care that they need to receive on a medical call. It's just going to look a little different. And instead of all 4 of us charging in and taking care of somebody, there's a line of questioning that we're asking when we're 6 to 10 feet away from the patient. We're evaluating their clinical status from 6 to 10 feet. If they need medical intervention immediately, the amount of people necessary to treat that patient are going in and delivering that clinical medical care that they need. And so it's not all 4 of us.
Right.
There's times where, you know, if the signs and symptoms from that 6 to 10 feet away from the patient is not critical, the patient will be informed, you look like you're fine right now. We'll go through a history from that distance. We'll wait for the medics to arrive. The paramedic actually needs to be the one to go in and start really touching or talking to the patient and going through any treatment modalities that they need to go through. But that's one clinical person going in and doing that instead of 4, 5, or 6. And it's just that type of policy that is going out today to all of the first responders. This is how we're operating, and by putting those things into place, it helps with that burn rate, and it protects our folks, and it protects the patient and the next patient that we have to go take care of.
Makes sense.
And like I said, your regular day-to-day calls still come in.
Yep.
And this is just an addition.
And those day-to-day calls now are going to have to be evaluated for the potential of exposure, because again, as this grows, those individuals that are having a heart attack may still be infected. So again, calls that we were going into before that were just what we call routine calls on a day-to-day basis are now going to potentially have exposure. So again, we're having to take those steps in using PPE to go into even general calls. With somebody that was going to go be tested at a private healthcare provider that gets into a motor vehicle accident. Well, just because they were going to the provider, they're now a trauma patient that has COVID-19. So we have to look at this full circle, and our way of life, if you will, in the healthcare side of things, with is a silent, can't see it. We have to always have that assumption in the back of our head for exposure, because the first thing that's going to happen is if I approach Todd, if you will, without any sort of respiratory protection or any PPE in place, as soon as I'm done, I'm on a 14-day quarantine, so I don't get the rest of the ambulance crew, the station, everyone else potentially exposed. And all that's doing is losing staff and so on and so forth. So we're really trying to do this in a methodical way that, one, we don't lose staff, we continue doing what we need to do. It's a very in-depth look, and that's why I needed a team to look at this and formulate all of what's going on to stay on top of this. And that's where this team is doing that, and that's why we have established what we've established.
Any other questions of Mr. Miller?
I have one more question that just came into my mind, and this is for Mr. Miller to explain to the public. There's a lot of individuals who do not understand why the information regarding the people who have tested positive is as limited as it is as to male and age. And so I think people need to understand the privacy issues, and then also adding to it that don't get a sense of, false sense of security because you weren't next to somebody who tested positive. I hope that makes sense.
Sure. Again, just as any test result, these are still human beings. These are still individuals. If they're individual tests, their test results are private. Again, where the stigma of this pandemic has shown also that individuals could be looked at different in the community, potentially threatened in the community, things of that nature. We need to do everything we can on the health side of things to protect these individuals. We released what information we could release. We also, again, as you described, putting a false sense of security. If I were to have released, in general, just to say that there was a case here in Leavenworth, people in other areas within our community would say, well, it's not here yet. And that's a lot of what you're hearing throughout the nation. Well, it's not in our community yet. We're still safe. And that's not the case. What that is someone tested positive and I have a result. That doesn't mean that it's not in communities. As Commissioner Shimke said, how many cars and how many families have been traveling back and forth out of Leavenworth into Johnson County, Wyandotte County, into the Kansas City metro where there are multiple cases. And those individuals were coming back to our communities and such, potentially spreading the disease in communities that we don't have positive test results, giving the community a false sense of we don't have it here. And if we don't have it here, we don't see it, unfortunately, this isn't like fighting a war and seeing an enemy in front of us. We don't see this. So if we don't see it, it's hard to react and say, I need to shelter in place, I need to wash my hands, I need to do all the things that I need to do right. So again, it was, in some regards, trying to push the message out. It's here. By just saying we have a case, it's in Leavenworth County, it doesn't matter where it is, pushes everyone to understand the need that this could be everywhere. This is just an individual that happened to test and we happen to get the result back that it's a positive. I can't stress that enough, that just as I'm saying today, yes, there's 7, but how many contacts that we don't know that have come from other areas that have many more cases, much more spread. We're having phone calls. I can't express that enough to the community. These phone calls of people, these are probably presumptive cases. I can't claim them as positive cases. I can't put that out of exactly, because I don't have a positive test. There's not enough testing to prove how many. What I can tell you is it is here. It is within our county. And that should be enough for everyone to understand the severity of what we're up against. These cases are here. You need to practice good social distancing. You need to practice good hygiene, and we will be okay. But if we don't, and we take blinders to this and say it's not here, we only have 7. I've heard that many times. I've been attacked over that many times. Well, we only have 5. We only have 4.
That you know of.
That I know of. Those are just confirmed. Those are confirmed. So again, I can't stress that enough to the public that it's here. We don't know the exact number. I'm going to tell you, New York doesn't know the exact number. That's just of what's been tested and what's been reported. How many are at home with those mild symptoms that also have it, or they're at home asymptomatic and still have it? It's here. This is a disease that has come around the world. It is in our little county of Leavenworth and is here.
Along
say that
with
enough.
150 other countries.
Yeah.
So, I guess sum it up, the benefit of many outweighs the wants of few. So, well, Mr. Miller, like I said, your staff has done an amazing job, and I just hope that you can hold up through this without getting down. with something. And I did have a retired nurse reach out today. Still holds a license. Wanted to know if there was ever going to be a need for volunteers for.
If they reach out, we at the if she'll send the message to the JIC, we are keeping kind of a tally of those individuals that have called in volunteer services and such, and we can call upon them when the time arises.
And
so
that person said that they've been in contact with several that do want to help if there's a need for volunteers.
Yeah. And that will be, we'll push that. We'll have a liaison within the staff that will be able to keep that roster kind of going with contact information. So if we get to that point that we need backfill into a hospital or backfill into the health department or backfill into wherever, we'll be able to have that list. So anyone that's, we're not asking right now for everybody to overwhelm the health department because that need is not there. We haven't put that message out. But if somebody is out, there will be a process for that to occur. And that will be everything from paramedics and such. The state is looking at different renewal processes and people that have retired and coming back. I mean, there's lots of processes in place that everyone from federal government all the way down through state governments and such for licensures and things have been being looked at.
Okay. And I get a lot of emails from vendors. Lately, I haven't gotten any from any personal protective equipment vendors. That all stopped for some reason. So, any questions of Mr. Farley or Mr. Miller? Said you guys are doing an amazing job.
I have a couple other things I'd like to go over before we finish up. So, one.
Hey, can I ask one question before you start, Mark?
Yep.
Mr. Miller, could you tell us what the number of test kits that you have? I know not specific numbers, but do you have an adequate supply of the test kits, and are you in a position where you're going to be able to get more of those? Or what's the situation with that?
Again, I went over what were available. The move has gone to private testing. Towards utilizing private labs from taking it away from KDHE only within the state. We do still have a limited number of test kits. I believe the last number I had, I don't even remember from this morning, but I'm going to say it's 50 or less. And it is difficult for us to get the reagent and the test kit specific to be able to test. So again, that's why at the health department side, we are very limited to those that I read off this morning off of the list from KDHE, what I can send in. Those will be where we will be still trying to run tests, if you will, and test those that meet certain criteria. However, it has now opened up for private healthcare providers to be able to send to Quest and things of that nature, and that's why we're starting to see our numbers. At the very beginning, the health department, our numbers were way up, and we had very, very limited to zero on private lab. And now on a day-to-day basis, I'm seeing more coming in from private lab than I am from, obviously, us testing at the public health side of things. So the shift has happened, and I've seen it. We've almost tripled the numbers in private lab just in the last 72 hours of the amount of tests that are kind of coming back in. So more and more are starting to send down to private lab to test, but the actual lab supplies and reagents for the health department remains low. But again, we're very limited on what the health department and the state is testing on versus what private lab is going to take over, because they just have much more. That's what they do. That is their side of the street, and they can just run that many more tests without being inundated. Our testing went from, at the very beginning, we would get test results back in about 4 to 6 hours to about 96 hours on a test result at the state lab.
Okay. Mr. Lawford?
One, I just want to. I think he said thank you. I just want to remind everybody that while the county offices are closed to the public, they are still open and doing business as much as possible. A lot of the transactions or daily interactions that you need to do, you can do via phone or email. They're trying to accommodate as best they can. So if you have things going on that you were with any of the county offices, reach out. They can make accommodations as best as possible. Secondly, the state did put out an order, the governor, that 60-day tags, license plates that have expired, and this is since January 1. Now, if you're driving around on a 1-year-old expired tag, you don't get a free pass. But after January 1 of 2020, anybody who has temporary tags, driver's license plates that are up for renewal or expired, they are waiving any late fees or penalties. They have instructed law enforcement to evaluate before they take action on any of those. And then my understanding is that once all the travel bans are lifted or all of the stay-at-home orders are lifted, they're going to extend that by 60 days. That's what's been talked about now. So you will have time to get that taken care of. If you can, do it online. Most of those stuff is available online. For the stuff that isn't, you will have a period of time after all the offices open up to get that taken care of before there are any ramifications. So I want to make sure that's out there for the general public to know.
Yeah,
I have one more question, Mark.
Go ahead, Commissioner Cos.
Okay, can you please address the inquiries about the necessity of travel letters?
Sure. There are no requirements to have a exemption letter. There are no roadblocks planned to check to make sure people have that. Businesses are not required to have exemption letters. Either they are exempt or they aren't. If they're not sure, they can email the JIC at leavenworthcounty.gov and get a ruling. Obviously, if you were already restricted, then you are still restricted. That didn't change. But yeah, there's no need for employees to walk around with a letter saying they're exempt.
Any other
Thank
questions?
you.
Is there any other questions? Then motion to adjourn.
Hey, Mark, can I jump in before you adjourn?
Go ahead.
This is for Mark. Do you know, and I haven't addressed this with Mr. Weber, but is the March 31st deadline for property tax assessment valuation appeals for your informal hearing, is that still a hard deadline?
I believe that is still a deadline. Again, that information is available on the appraiser's website and via call to the appraiser. They're still scheduling appointments over the phone, and then they're also offering that anyone who can't do that, they can pay under protest, and then they have an extended period of time to come in and conduct those hearings. So those, to my knowledge, those are still in place. And again, I would recommend that anybody who has that question call the appraiser's office directly to work through it with them.
Okay, thank you very much. I think that's something we should follow up on. Thank you.
Okay. All right. Motion to adjourn.
So moved. Second. Aye.
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 Thank you, and we will be back here tomorrow.